Welcome everybody to the Equine Touch Studio again. First time in January 2023. Ooh. Happy New Year to everybody. And we're all looking forward to who's going to join us tonight and where you're joining us from. And we're going to engage with Dr. Lizzie McCready, who's our going to be hopefully our tame vet. We always like to think there we can keep calling on. And then one of our coaches, practitioner, Nikki, who has actually undertaken some of Lizzie's training. So that's going to be a good insight for us to see what experience she had with that. So we'll just wait for some people to jump on, because I just want to make sure the signal's going out, because I'm not tuned into Facebook at the moment. So if anybody's there, please let me know. And Lizzie, we were just having a nice chat about what made you think about that you might be the person to offer this sort of training. So we've got one person joined us so far. So I just want to go back a little bit and just mention that as Equine Touch, one of the things that we are doing in our mission statement is to help horses by educating humans. And so it is really wonderful to be able to engage with Dr. Lizzie here, because that's what she's trying to do as well with her empowering equine education. And I undertook some of that this morning, your colic masterclass. What a joy that was. And actually, it's two sides of a coin, because you see it and then you think, oh my God, there's so much more that could go wrong. Mm-hmm. And so I had to then say, calm down, calm down. It's okay. So Liz is going to be talking to us about her attitude to equine emergencies and what's led her to develop some training to offer horse owners. Nikki's taken that training and is going to be engaging us with that. So we're going to start off now. And one of the things we have with ET, Lizzie, I know you've had Nikki on your horse health hub, and one of the things that I really liked about ET when I learned it, and one of the things we impress on people who come and learn with us, is it gives you that sense in your hands of a way of communicating with your horse, a way of touching into their well-being, and to hopefully pick up when they're not quite right and be able to act on that. And then the other thing is to keep things at an even keel, because we can keep topping it up. We're not having to just call in other professionals. We have a skill that we can use for ourselves. So obviously when things start going wrong, and I've certainly been in this scenario, and I'm sure lots of us have, so lots of questions, please, everybody, and do let us know where you're joining us from, because we love to know all those sort of information. So Lizzie, one of the things that we always do is, oh my goodness, it's an emergency, or I don't know what to do, I'm going to call the vet. And we expect the vet to be able to respond immediately and know exactly what's going on with our horse and rescue us. So what's been your experience of that as being a vet? Because that's a huge responsibility that horse owners sort of pop on your shoulders.
Oh, it is. Absolutely. Firstly, thank you so much for having me on, ladies. Lovely to see you again. Nikki and Chris, thank you for that fantastic introduction. Yes, emergencies, they're enough to make any of us go into a complete panic, and it really even switches the blood response going on in our brain. If you think about any time that you're stressed, immediately your blood flow changes and your logical brain switches off. So to be honest, I've had a real range of emergency experiences with clients, but nothing surprises me. I've had owners call me saying their horse is stuck in a ditch and they can't get out, or unfortunately their horse has been caught in a bushfire or a stable fire, or they're stuck in a fence. And each time you're encountered with a situation like that, the first thing I always do is breathe. With the majority of owners, because we're coming from that state of panic, we tend to just blurt a lot of information down the phone without actually providing the vet with anything that's really valuable. All that's really in that conversation is get here ASAP. And actually what that does is it just leaves a massive gap for the vet to be able to give you really personal advice that's relatable to the situation that you're in, that will help tie you over until they get there. So let's say, like, for instance, we went through colic this morning. So you call up, you found your horse, they're thrashing in the paddock. You don't know when the colic might have started. They might have a few abrasions on their eyes, but you know to call the vet straight away. That is fantastic, because colic is always a veterinary emergency. But what can you do apart from just saying, my horse has got colic, please, when can you get here? If we actually think about it and take a step back, if you actually start to look at the horse completely and do a full horse health assessment, which is something that we can talk through in a little bit more detail later, it then provides you with all this information that you can recall then to the vet. Then you can work as a team together to decide, okay, do I need to get there right away? Okay, have I got half an hour up my sleeve? Or potentially even, do you need to take your horse straight to hospital? all of a sudden you're opening up that opportunity to communicate.
Yeah, Lizzie, and one of the things I just wanted to mention was that I wasn't really aware, was you were saying how there's a shortage of vets, really, Australia in this country. And I certainly know someone recently called their vet to come out and they said, oh, can you bring it to us?
Really?
And you just wonder whether we're going to be able to access our vets so easily in the future. So maybe, that may be something that we need to consider as well.
And especially in the horse industry, what's really fascinating is, as a vet going through vet school, you get taught that there's really only 1% of jobs available for equine vets. So a lot of people get put off that. But in reality, equine vets are always really sought after. Unfortunately, there's quite a high turnover rate. I was shocked to learn that the average length, especially of a female vet's career, is 5 years. Can you imagine that? That's how long we take to study.
Females coming through now as well, I think. It's certainly within the UK. I mean, my mum actually was a vet. I just want to mention.
Oh, wonderful.
Still alive at night, 6.5. But she did her training at the end of the 40s. There were 3 girls on the course.
Wow.
And all the rest of the course were men coming back from the war, mature guys who were looking for something. So, she had a very different experience, I'm sure, at vet school than you did. But carry on with your story, Lizzie.
Yeah, no, absolutely. The times have really shifted. And I think it's because you need pretty high grades in order to get into vet school. And it's more so the girls that are willing to put in the legwork going through school in order to get to that state. There are some fantastic male vets out there, and the male vets tend to be the ones who then dominate the higher levels of the workforce. They're the ones that own the practices because they don't need to take time away to have kids. But unfortunately, what it has left us with is a slightly higher turnover rate. And then in some places, just a real shortage. I've seen it more in Australia than I have in the UK because of the distances I think that vets have to cover. But I am aware that it is something that we're experiencing here too, which is why it really boils down to us equipping ourselves at that foundational level. So as owners, we're not left feeling helpless, and also we're helping to support the vet industry from the ground up. I think that's also really important. We've got to look after our vets.
Well, you mentioned about it being a teamwork thing, that if we can provide them with a little bit more useful information, one, it helps them to decide in the first place, how much of an emergency is it?
Yes.
Whether you need to go straight off to the hospital with it. And also it just enables you then to show that you have a little bit of knowledge, and maybe they're going to be a little bit more open with you as far as speaking to you about options and things like that,
Completely. Like, the more you'll be able to see eye to eye, which I think both parties really, like Nikki, I know that one of your main intentions when you came into the course was to be able to speak more intimately with the vet. Is that something that you feel you've got more experience with now?
Oh, absolutely, definitely. And just understanding where the vet's coming from. I think as somebody like me, where I'm quite holistic and I sort of try to strive more holistically than like a medical approach as much. I think it's helped me understand where the vet's thinking, what's going on, why do we need to make these steps, etc. So I'm more confident in their decisions, but also I can communicate easier with them when it comes to dealing with a situation that's quite stressful. And just giving me that extra skill in my box just to support my horse and be able to treat, well, not treat, but help him where I need to help him. So it's I think it's been a huge help to do the course, really, especially for like me personally as a horse owner, but also professionally as well. Like, it's been extra helpful to know that what I'm dealing with, what I'm looking at with a horse, if I need to have it referred to the vet, for example, when I'm out there on the road treating a horse or working with a horse. But equally being able to just help the owners understand a little bit better what their vets might be thinking. If when you're chatting and stuff and you have a little chat and a little moan or a whinge or whatever, but you can say, well, actually it's probably why they did this, or those sort of things. And I think that's really helpful just to understand where everyone's coming from.
I think also the idea, Nikki, that you're there for an hour at least, and so you get a lot of questions that maybe people have saved up, and sometimes we get asked to go because they don't want to call the vet.
Absolutely.
That could be more expensive. I've had called out on a Sunday, and the horse had laminitis, and I had to say it's got laminitis. I have to call the vet. So it's having the confidence of knowing this is something that does need to be referred to the vet, or because it's so difficult. another thing I want to ask you about, Lizzie, but away from this, you know, it's so difficult when, especially when there's abdominal pain. Well, what could it be? There are so many different things. It could be a tight psoas muscle, but there's a lot more internal that it could be that's a lot more dangerous.
Yes, absolutely. And it's like, what is more it's more dangerous not knowing enough than knowing too much. I know sometimes you can open that can of worms and think, oh my goodness, what have I let myself into? But really, the more you can educate yourself.
The can of worms. So
there we go. Absolutely. Can of worms and abdominal pain all in one. This is something really simple. So worming, people don't and worming is something that even as a vet, I find hard to wrap my head around sometimes because it's changing consistently. It depends on where you live in the world, what husbandry techniques you tend to have your animal organized within, and what wormers you're using, what their specific resistance is, what diagnostic tests you have access to. Like here, you can test for tapeworms, but in Australia, you can't. And if that's something that you just let fly under the radar, and it's really easy to do and easy to forget, all of a sudden you can end up with a problem like this horse in the center who had an ascarid overload, and this burden literally blocks the small intestine. So this can lead to a life-threatening colic condition. And it's about us just thinking whole horse, big picture, especially holistically as well. I'm going to treat them from every angle that I know is going to be beneficial for them. But what I'm really focusing on is preserving their longevity and their health in the long term. And how can I do that? Is by putting in the building blocks and laying the foundations so that they don't get ill and they don't get injured in the first place. But if they do, I'm giving them the optimal chance to recover as soon as possible. And I'm making the whole ordeal as minimally stressful for me and my own horses. And that's where working with other practitioners like ET therapists is fantastic, because again, you guys are on the front lines assessing these more chronic pain conditions that we're seeing in horses that vets might not be able to actually fully address. And I think a lot of vets tend to almost like poo-poo the alternative therapies, but actually we need to be working together. It might take 10 different people to get one horse right. And it's about keeping open and knowing how to work as a team, but also as an owner, don't disempower yourself to professionals. Don't just think that you've got to spend endless amounts of money always calling on someone else to help your horse. There is so much that you can do to help your horse in the day-to-day, which actually provides, I think, so much more fulfillment as a horse owner, because deep down, I know all we want as a collective is to make sure that our horses are happy and healthy.
Yeah. And I think when you can give some sort of peace of mind in having a bit more knowledge, then it means you and confidence that you, if something awful happens, that you can respond, or you can at least stay calm and bring something to the table, then you can be more calmer the whole time, because you're not sort of sitting there thinking, oh my God, this might happen to my horse. Oh, what happens if, you know, that sort of stuff.
Completely.
Show this picture on the top left here.
Yes.
The pedunk. I thought this was an amazing picture, because I know I've heard of this, but I never thought it'd be really white like that. Just speak a little bit to that.
Yes. So this top left picture, this is actually the inside of a horse's abdomen. This is when we've gone through colic surgery and we're removing the guts from the horse's abdomen to have a good look at what is going on. Now, what we can see here is this really dark purple loop of small intestine. Now, normally this should be nice and collapsed, but here it's very distended and taut, and it's dark because the blood supply has been cut off, and it's being cut off by this bright white ball. So this is called a strangulating lipoma. Now, this ball is just a fatty mass, and it has a stalk that attaches it onto another part of the abdomen. I imagine it a little bit like a Christmas bauble. It will just be sitting in the abdomen, minding its own business, not causing any harm, but then one day, spontaneously, for no given reason at all, it will actually lasso itself around the small intestine and cause a really sudden onset colic. And this is why when you are picking up the phone and calling your vet, it's really important to tell the vet your horse's signalment. So this is their age, their breed, and their sex. Because if I get a horse, an owner that's calling up and saying, I've got a 2-year-old filly, she's come down with acute colic, I'm probably going to be thinking more along the ascarid worm route. But if it's a 30-year-old horse that's was absolutely fine this morning, but all of a sudden has gone down and doesn't want to get up, my mind's going to start going more towards strangulating lipomas. Now, we don't see these strangulating lipomas only in horses that are overweight. I don't want you to think that at all. They can occur in any horse of any age. And it just goes to show that no matter how well you look after them, these things can crop up out of nowhere without warning. And what I don't want you doing is all of a sudden resorting to a Facebook group or resorting to Google to get your advice in the heat of the moment. It's far better. Either definitely just pick up the phone to your vet straight away. We're really lucky that we're a profession where you can get advice for free. We're not going to charge you just for answering the phone like lawyers and doctors. You should be able to always get hold of someone when you need them. But it's also nice to know the actionable steps that you can put in place in the meantime, while you're waiting for that phone to ring, just so you can, again, give yourself that self-assurance. I was actually on an airplane flying over from Australia to the UK recently, and there was a man on there who had a heart attack, and you could hear the air hostesses repeatedly calling, is there anyone here who has medical experience? And my goodness, I was like, I'm a vet. Is that going to be good enough? But everyone else was asleep. And I was
Well, they all run into the back of the plane, so it started tipping its nose up. Because normally, in my experience, you ask for anyone who's got first aid experience, and they all run in the opposite direction.
Well, yeah. And you know what? It was a really awful situation. Like, I went up there to see if they were okay and see if there's anything I could do to help. I immediately started thinking about my acupuncture training. I was like, maybe I could use a resuscitation point. But again, I was like, I feel like I'm overstepping. But just being in that scenario and being like, there is no one here to help this man. There's nothing worse, really, than just being in that helpless state. And it's like, you would do anything in that moment in time to just do what you could to help. And we can end up in that same situation with our horses. I've had clients who have reached out to me and said, I can't get a vet for 24 hours. And it's like, what are you going to do in that situation? And there's a quote that I absolutely love that says, we don't rise to the occasion, we fall to the level of our training. And I think we very much get caught in that sense of false security in the first one of, I'll deal with it as it comes, you know, good bit of life experience, I'll just crack on with it. And it's like, actually, that's not what happens. So that's just why it's important to ask yourself, okay, what training have I had? Was it a while ago? Is it up to date? Could it be better? And just being a little bit more self-aware of what your own capabilities are. Yeah.
And you're not talking about knowing exactly what the vet's going to be doing, but what you're offering is something along the lines of experience in monitoring their life signs.
Yes.
You know, so the obvious thing, like being able to, I mean, I've taken horses' temperatures, but I don't have a temperature thing myself. You know, we're all like that. I've sort of looked at breathing, but not particularly. You know, I can get a digital pulse, but, you know, just to be a bit more systematic.
Yes.
You know, and then knowing what intervals to be able to track any trends that might be going on. And then being able to deliver that to the vet, you know, in the way that they need it. So do you want to talk a bit about that? Because is this the slide that we got, this ACT one?
Yeah, so I've got a couple of, I've got one acronym that I have based most of the equine emergency response training around, because like you said, systems really help. You might be thinking, how come the vet is always cool as a cucumber, even if my horse's leg is spurting with blood and the whole world looks like it's falling apart? And that's because we've got so much training to fall back on. It just becomes second nature. Like, we always do things in a certain order. That way we don't forget. So when I was designing the course, I thought, how can I create a very similar thing that owners can use so that they can just switch on this part of their brain when things go wrong and they're not having to kind of work it out all the time. So I thought, okay, let's break it down into how to act. So the first thing you want to do is always assess your horse. And that is what you were touching on just then, Chris, which is the horse health assessment. So yes, there are lots of people that think, okay, I can take a digital pulse and I can look at the breathing and take the horse's temperature. But actually, you can set yourself up to do a full horse health assessment. So that's where we're doing demeanor, respiratory rate, pulse rate, gut sounds, gum color, capillary refill time, skin pinch testing, and digital pulses. And this is pretty much exactly the same clinical exam that a vet would do. But there's no reason why you can't also learn and practice it. Yes, you might be a little bit more fiddly in the process than a vet is, but still it's something that you can easily get to grips of. Then once you've got your full assessment, I love providing my owners with a record sheet, because it can be a lot to retain in your mind all at once. So you can record your results, and then you can use that to reflect back on, actually monitor the horse. And with that information, then you can call the vet, and then you guys can have a proper discussion. Now, I think a lot of what our conversational skills boil down to is how much we trust each other. So I think, like Nick, you were talking about that earlier, when we don't always necessarily trust what the vet is telling us, and that second guessing can then kind of seep into our relationship with them. And then we wonder, am I doing the right thing for my horse? And also, am I doing the right thing for me? Because I always have to take the owner's personal considerations into a treatment plan as well. And then the vets we make a intuitive judgment call on how much we trust the owner based on how savvy they sound. Really, it's like,
and whether they get to carry out what you're asking them to do, type thing.
Completely. So the more clued up the owner can sound down the phone, and especially in person, the more we're going to feel confident being like, okay, we can do this together. I'm willing to give you more of a free rein. I don't need to come out and see your horse every day. Actually, I can come out every few days and we can manage this together, which as a silver lining is actually going to reduce your vet costs with the bill, also vet bill costs in the long run. And that's where the treatment piece really fits in. So treatment kind of goes into two categories. We've got the first aid treatment, which is obviously that immediate care that you're going to give the horse while you're waiting for further medical treatments, normally by the vet. But then how often does it tend to just stop at that one incident? You might be dealing with your horse that's got colic, and then you might be going through a certain refeeding protocol for 3 days afterwards. Or if you've got a horse that's got a wound, you might be bandaging that for weeks or months after the incident, which is one of the reasons why, instead of just calling this a horse first aid course, I called it the Equine Emergency Response Training, because it really encompasses all phases of dealing with emergencies: prevention, dealing with the acute incident, aftercare as well, and wrapping that all up in a nice bundle where you're getting a lot more knowledge about horse health, injury and illness, so you can just be more clued up about what could potentially go wrong with your horse, which helps set you up for success, really.
Yeah, because I was sitting there thinking, you know, I mean, I've had horses that had colic surgery, and I was talking to a horse who had atypical myopathy, and you know, and I'm okay with the stressful emergency thing, because my job, you know, I had to deal with emergencies with aircraft, so they might crash. So you've got to be able to hold your nerve. So I'm good at holding my nerve, you know, and you can do that in the initial thing, and then it's like, you don't often think until you're actually faced with it, well, how am I going to manage this afterwards? You know, when I'm in a livery yard, do I trust that they're going to give my horse company so it doesn't get stressed? You know, I've been very lucky. One, I've had money so that I can, you know I can buy help if I need it, but I've also got some good friends who really supported me when I've needed it. So the aftercare is so important, and that might inform whether or not you go for surgery with some things, you know, how you even address the whole situation if you don't have the support afterwards to carry on giving your horse support. Sometimes it's not fair on the horse. Completely.
And often when you're in the heat of the moment, the vet doesn't have the opportunity to run through all of those situations with you. At that point in time, they might actually have another emergency that they need to rush off to. So it's why it's like, the more you can know beforehand, the better. And then the easier your decisions will be. And you know that you'll be making decisions that are more in line with your desires and your horse's needs. Because otherwise, if we're just caught up in the heat of the moment, I mean, I've been in countless situations where I'm like, I would do anything, I'd remortgage the house. But if you end up putting yourself into a financial position where you can't afford to feed them, then again, it's a catch-22. So it's like, the more that you can just know prior to having to make a big decision like that, the better, which is one of the reasons why I love going into colic and then actually educating people about colic surgery. Because I had a very particular mindset about colic surgery before I trained as a vet. I was under the impression that it wasn't good for horses. They'd never come back to the level that they used to compete at, and it was a bit of a waste of money. But actually having been in the hospital and seeing how incredible and life-saving this surgery is, and having seen horses walk out of the other side of it and go on to not only compete at the same level, but a higher level, completely shifted my perspective. But
and also you were a anaesthetist, aren't you? So, I mean, they never used to offer colic surgery to, you know, our sort of horses in the past. It was really expensive thoroughbreds. And I suppose, you know, my horse ended up having colic surgery because I was 500 miles away, and it was like, well, you either say to your friend, put him down over the phone, which is, and it was Christmas Day, or do you say, yeah, take him to the hospital and let's see what happens. So, and then you're dealing with the outfall of that, because I think he was very stressed by it, but mostly more about the situation afterwards, because I couldn't be there. I couldn't be there to do the rehab. So he herniated and, you know, all sorts of other things. But he went on for another 5 years. But
amazing,
because I did ET, you know, and he was always great at helping me learn with that. You know, he had a role in that sort of concept. I didn't expect to go and ride him or anything, but all the that it brought up. You know, that's the other thing we talk about, isn't it? How we all feel so bad about the horse has got sick and it's our fault, and you know, I couldn't have done this, and then you're canvassing everybody else's opinion, and you're reliving the drama. You know, you can just get into such a mess, can't you, Nikki? Now, when you were doing the course, did you have something happen with your horse when you were actually doing the course?
Yeah, he had a fractured head at that point.
Oh my God.
I know. So he doesn't do things by halves, Clive. He's like just likes to test everything, really. And like the year before, he'd had just got over necrotic cellulitis, and that taken probably the best part of a year to recover from. And then he went and fractured his head the following January. So it's been a year this month now. So touch wood, he didn't do anything else. But yeah, it was so helpful to be on that course at that time as well, because it, like, talking to Lizzie, like we had that opportunity in the one-to-ones with the Zoom calls and stuff, and then I was able to message Lizzie quite frequently as well, because you're always on hand, which was amazing. Just for like that second opinion, you know. And there were moments at the start of that issue where I was really like not sure what was right and if I was happy with the decisions being made, etc. It was talk about surgery, and I just was like, I don't know if I want his head sawn open, and you know, all these things. And it turned out, like, not to discredit anybody who was trying to help him, but it just turned out to be something a bit different to what we were predicting initially. So surgery wasn't needed. It was just time and aftercare to help him recover in the end, which was like the best result I could have had. But just having that, like doing that course, having Lizzie on hand at that moment was just so good. Like I wouldn't have got through it without those times I had with Lizzie on the course, really. And just like understanding the body better as well. I think that, like, knowing that was even, like, you know, that was super helpful.
And do you find, Lizzie, that it's translated? Because I see that initially you did the courses face to face, did you? But now you're translating it to an online. Something very practical. You think, how does that work? You know?
Well, it was actually online to begin with. So I started the course. The first round of students came through in November 2021. Sunshine. Yeah, no sunshine. It was Australia. It was November 2021, which is obviously when we were going through COVID, which in some ways was fantastic because lots of people were online. So the full course is an 8-week program, and there's a combination of live lectures like Nikki was talking about, as well as practical tasks. So what I tend to run through in the workshops, I've actually just videoed everything and broken it down into kind of 17 training videos, so you can work through those in your own time, have access to them at the touch of a button. And then actually I get the students who are doing the online training to go and practice these skills. So Nikki would have done this. So I get you to do a lower limb bandage, a hock or a knee bandage, a foot poultice, and then you get to really entertainingly video yourself and send it back to me, so I can actually give you one-on-one feedback and fine-tune those skills, because it's important that you have your dress rehearsal and you're flexing your emergency muscles, and the first time you try to execute these practical tasks isn't during a mid-emergency when your horse is stressed. Now,
and we could say things like bandaging.
Yes.
You know, I'm presuming you're showing here that problem. I've only had to do it once with a horse with a tendon, and then it was that I was probably doing it too tight, because then the skin started sloughing away.
Yes.
And I had to put a bandage on before. You know, it wasn't in my experience at all. You know, and you're just left to it.
Absolutely, absolutely. You're just figuring it out as you go along. And the dangerous thing, Chris, is that you just don't know any better. The vast majority of time I see mistakes happening with people's horses is not because they've intentionally tried to do anything wrong. It's just because they have made an honest wrongdoing and they just haven't known how to do it the right way. So it's really important that we do learn to do it the right way, because things can go wrong when we bandage. So we've got two images here, one of the front of a horse's cannon and one of that coming down the back of the horse's cannon. Now, both of these sores have developed because of poor bandaging techniques. Now, the bandages are either being too tight or potentially not tight enough, and it's slipped and then caused a rub. Coming down the front of the leg where this wound is, it would have irritated the extensor tendon that runs down the front of the cannon bone, and down the back of the leg, it's obviously rubbed the skin off the back of the superficial digital flexor tendon, and would have actually irritated that tendon underneath as well. And one of my pet hates is seeing just straight vet wrap wrapped around horses' legs. We can definitely do better than that, everyone. Vet wrap itself shouldn't go onto skin, because if it does go onto the skin, it can contract, it can rub, it can cut off the blood supply. So you always want to have a base layer underneath, at minimum a thin cotton softband layer, but what is actually ideal is a thicker cotton wool layer. At the end of the day, like, you should only really be bandaging the horse's leg if it needs to have the movement restricted, if there is swelling there, or if there is a wound that's potentially discharging or is big enough that it needs covering up so it doesn't get contaminated. And each of those three reasons are enough of a justification to warrant a proper bandage being done instead of something that is half-assed.
Yeah. And I suppose, and also, you know, for me, I've had like 3 horses in my life and a pony when I was a kid, you know, so I'm running a yard or something. So you sort of sit there and think, well, is it worth that investment? But, you know, and I'm getting on in years. So, yes. But then I suppose I can give that reassurance to other people. But yeah, I would think certainly it's something I would like to have had. But are you the only person who's offering this sort of thing, you know, Lizzie? I mean, what made you think that you were the one who, you know, that could be Dr. Lizzie on the on
the social media. It's definitely not what I had in mind when I originally went to vet school. But exactly like you said, Chris, sometimes you don't choose things, they choose you. And I went through this huge personal experience where I was working really hard as a vet. I was seeing like 12 horses a day. It was throughout COVID, and we didn't catch a break because, well, what was the point in taking holiday time off if you couldn't do anything with it anyway? So I just worked through, and unfortunately I fell into the trap that a lot of vets fall into, which is I physically burnt out. I burnt out, herniated a disc in my back, and I was forced to take a period of time away from doing all the vetting. And at first I had this big identity crisis. I didn't know who I was if I wasn't Lizzie the vet. Yeah. But then I actually received a gift from that whole experience. I tend to be very much a person who's got my glass half full rather than half empty. But anyway, the gift that I received was time. And I actually had to sit back and I started thinking, could I be making more of an impact to the horses and the people that I care so much about? Instead of just running around a million miles an hour and trying to save the horse a world at a time, could I be doing more? And it didn't take long for the idea to drop in. And when it was like, actually, this is something that the horse community really needs. Yes, there are a few people who are educating about first aid, but there aren't any vets out there who are really helping to bridge that gap. And I looked back on my own personal experiences. We'd had a horse that had to have a C-section. We'd had limitick ponies, mares that had strangles, horses that had cut their legs open, a horse with peritonitis, all before I'd even gone to vet school. And thinking back to those scenarios and remembering how little I knew then compared to how much I know now, I was like, I have so much more to give than just what I'm doing in my face-to-face.
Yeah. And so sharing, that's a fantastic thing to do. And I suppose the other thing is, if you're drawn to that and you've got the communication skills, then I mean, really, you should be doing that.
Yeah, and I guess I'm fortunate in that way.
The bushel, or what is it, bushel under a tree or something? Can't remember.
Yeah, exactly. And I guess a lot of vets are they're too busy running around trying to work within the same model to be able to have the capacity to try and take any more on, because it is a full-time commitment wanting to set up a business and start teaching people. Like, I spend a lot of my energy interacting with my audience and trying to give them as much personal vet tailored advice as I possibly can. And it's nice just to be able to pair that with then the one-on-one work that I do, because I've obviously now specialized more so into the veterinary acupuncture route, because again, like I said, I'm a really keen learner and I want to give my clients and my patients the best service possible, which is why I've always been really driven to work in specialist areas. But again, it all just fits into that big picture of how can I be and encourage more proactiveness. Because when I got injured, it was a really rude wake-up call to just how reactive I'd been, just dealing with life as it came up, until I got to the point where I had just physically wrecked myself. And it's like, actually, there is a different way, and we can all be operating from that standpoint. It just takes a state of mind shift. And I thought, I'm going to just start bringing that to people's awareness. And one of my main intentions was also to help the veterinary industry from the ground up, because I was like, it's not going to be able to change. Vets aren't going to be able to work any less hours. We need to actually be supporting them. And one of the best ways to do that is by giving more empowerment to the owners.
Yes. And demystifying the process a little bit, I think, on what they're doing, because that must put so much pressure on the vet themselves. You know, I've written a note here about challenges for the horse owners in a stressful situation, challenges for the horse, but also the vet.
Yes.
When they only got a small amount of time, they're having to do rush around, and then they're having to walk away from an animal, and they've got to sit there and think, well, actually, maybe in my own opinion, I'd have done something different, or I'd have maybe not continued with it, but the owner wants to, and you've got to deal with things like that. I would think that was really stressful for the vets.
Yeah, it can be. It can be really emotionally taxing. You do get a lot of vets who end up with compassion fatigue, because their emotions are just being stretched so much every single day. And it's because you're not only you being there for the animal, but you're being there for the owner as well. And I completely understand it. If you're there trying to educate the owner and help the horse all at the same time, it can be a lot of juggling. But that's why I really enjoy spending as much time as I can with my owners. And that's the beautiful thing about doing acupuncture, and what you would receive with ET is you get that time period with the owner in order to go a little bit deeper on what's going on. With as small animal vetting, you've got a 15-minute consult. With equine vetting, sometimes it's only half an hour. There isn't really that opportunity to kind of crack into the deeper layers, which I think is really important, because at the end of the day, owners just want to feel heard and safe and reassured that they're making the right decisions. And I think sometimes vets get a little bit caught up in the medical side of it, of what's going on, to be able to have the time and the space and the capacity to give the owners that support.
Yeah.
And I think, sorry, Nikki, you go.
Oh, sorry. I was going to say you almost need like an emotional, oh, I can't think of the word now. Like just support team. Like the police do when there's been something that's happened. The detectives will go off and do their work, and then the police refer that person to a emotional support team. And it's almost like in a vet practice, they need that as well on top. So, because I know for me, like when I was going through stuff with Clive, I was an emotional wreck. Like I couldn't deal with it, and I was questioning everything. And I just, not so much his head, but when he was having necrotic cellulitis, that was just so difficult. And it was a lot for me to put that onto the vets as well when they're trying to just help save his life. Like they were doing everything they could. I just couldn't cope with it. Like I couldn't cope with that emotional trauma almost that I was going through as an owner. And so there almost needs to be some sort of team support within the practice there, I think, maybe. I don't know. Been thought of.
Well, but then you've got to, then people have to decide whether they're going to recognize that they are in a stressful environment and whether they're going to engage with it, you know, because it's getting more and more to the fore, isn't it? People are much more open about you know, their feelings or the fact that they maybe are struggling with things. I suppose if the shortage of numbers, then the pressure's on. And I know certainly within the UK now, there's a lot of practices being bought up by corporations from other countries, and so you never get the same vet twice. There's a high turnover of vets, and it doesn't mean the vets aren't any good, but they're getting even more pressures on them now.
Yeah, exactly. And then it comes down to, again, that trusting. It's like, if you can't guarantee that you're going to get the same vet out each time, what can you do to help safeguard yourself so that you just feel as confident as you can be? But those points you were bringing up are really important, Nikki. And it's how, when you were talking about your experience with Clyde and how it was really emotionally overwhelming, this is something I want to ask back to you ladies, is how do we start that conversation about really making people aware of their priorities? Because too often I see people more interested in making sure their saddles and their bridles and numbness are all color coordinated, as opposed to making sure they've got a first aid kit in the box, or the fact that their horses are musculoskeletally pain free. And it's like, is there a way that you find you end up talking with your owners to help them shift that mindset, or obviously is it different in your field?
I think from my perspective, I think just like probably same with you, Chris, teaching the courses to the horse owners is where we really kind of are able to delve into that a little bit more. When you're just out sort of treating a horse, working with a horse to give body work, it's obviously a conversation that I will have if I need to, and I'll discuss with the owner. But it's hard to, like, I feel like you always have to be quite diplomatic in your with your responses to those sort of situations, because equally you don't want to be making a kind of diagnosis anywhere, and that's, you know, that's quite challenging, and you don't want to obviously badmouth anyone. Like if there's saddlers doing something, whatever, you don't know what they're working with. So it's one of those things that I think for me, I probably just encourage the owners to look at the whole horse and consider everything, as opposed to just trying to pinpoint something particularly. I don't know about you, Chris.
Well, I think one of the difficult things is that when people have asked, you know, someone like us to come out, you know, someone to do equine touch, or they've asked for another sort of practitioner, then they're trying their best.
Yeah.
And the last thing you want to be doing is putting any sort of judgment or guilt on them. You know, to the extent sometimes I'm never even very clear about, oh, your horse is in pain. You know, it might be, oh, well, there's discomfort here, or they're avoiding certain movements because that's triggering pain in them and things, because otherwise they then feel so awful about it. And we're going to have discussions about saddling at another time. But I've had times where we've identified that, not me, but in conjunction with that there's a problem with the saddle. But then people go, well, I haven't got the money to do that.
Yeah. And
so they persist with the horse still having problems musculoskeletally, with them not enjoying their ride, with them feeling obviously bad about it, because they're then, you know, sort of battering away the question about it, because it's a case of money. And so it's a very difficult, it's, as you say, folk are off there buying, you know, buying all these nice, colourful things. And it's like I say for the rehab options, or how are you going to care for your horse? I've looked at a horse, and it's somebody I know, and they're you know, and I see the horse near enough every day, and you see the feet need attention. Yes. And they go, well, I haven't got the money. And I sort of said, look, I'll pay for it, but I just don't want to see the horse looking like that.
Yeah.
Because I'm lucky that it's coping and it's not getting more of an issue. But it's a shame, because I think on some way the horses know as well. They know whose owners are, which owner is giving them good attention. The ones that are getting it within the yard, and you see them looking unhappy. And
I think it's breaking habit as well for some people. So, you know, if you've always ridden, but actually you think it could do with some work from the ground for a while, you know, let's take it back to basics. But all they know is how to ride the horse. So that for them is a real conundrum. Like, and I understand it, you know, it's not a dig or anything, but it's just, you know, trying to, I guess, just trying to educate people as much as we can with what we've got. And that's why, like for me, coming back to Lizzie's course and the Equine Touch courses, it's all about helping the owners to know more, and without it being you know, a degree, or you have to commit to this and this, or it's not going to cost you forever, or whatever it is. It's, you know, it's accessible, and it's in our terms that we can understand. So it's, you know, it's not going to be overpowering or overtaxing on you to learn these things, but it's going to help you massively to make better decisions, for sure.
And I think it's like taking the blinkers off, isn't it?
Yeah.
And I think it's empowering the owner, because you know, when you're in a livery yard, like when you're saying with an emergency situation happen, you might be going and saying to someone, oh, what would you do? I've had people say to me, the horse with colic, well, what would you do? And I had to broadly say, because I had not, you know, we'd actually been told we're not supposed to offer things unless somebody actually asks. So you think, okay, I'll wait for them ask. And I said, well, I think he's dying. You know, because the horse was dying, and the vet had to come back, you know, but it was like they wanted everybody to validate their decision, or make their decision, and then you wonder 3 years down the line, maybe they're going to regret, oh, I that didn't really work for me, or maybe I could have made a different decision, and all this sort of stuff going on. So I think the more you can feel empowered in yourself, manage things yourself, and not be drawn by other people, or drawn pressure of people looking at you. You know, what are you doing that for? Oh, well, that's, you know. So it's personal development, isn't it, Lizzie? Then it's all about, you know, gaining your own strength and understanding yourself and how you operate in the world.
And it's, do you know what? It's a huge responsibility to be making a decision on behalf of an animal. It's one of the reasons why I am continually developing my own veterinary expertise, because I'm aware of how much there is to learn. And I don't want to be making the wrong judgment call on their behalf. I take that responsibility very, very seriously. And I feel honoured that I'm like one of the custodians of the earth who's here to help protect the animals. Like, it sounds really, really cheesy, but I think it's really important. They're not their own spokesperson. And I think people actually take horse ownership far too liberally. That you need a license to own a reptile, yet you need absolutely nothing in order to own a horse. And unfortunately, especially when it comes down to emergencies, it's not really a matter of when, but if. And it's like, if you're going to be leaning on other people and their decision-making skills, you need to be asking, how are they making that judgment call as well? Are they making it just based on life experience, or have they actually had some form of training? Because you might then just be putting your power into someone else's hands, and who knows if that's actually going to be the right thing for your horse. And it's tricky. So often it does come down to the conversation of money. And I grew up in a environment with my horses where we never splashed the cash on the horses. We always bought them young, brought them on ourselves. We always did it on a shoestring. But there was nothing worse than them being in a medical crisis. But the horses always got what they needed when the chips were down, and we would make it happen. And that's when it really comes down to less so, do I have the money or don't I? It's just a question of our priorities. And it sometimes doesn't feel very comfortable discussing it in that way. But I think it is really important that we just start asking ourselves, because again, we do need to be prioritizing more so the fundamentals and the cornerstones of health. So being free from pain, having fantastic hoof care, making sure nutrition is on point, they're free from injury and disease, and we're also helping protect ourselves if an emergency happens, versus having 5 different colored saddle pads. But it's easy to, like, at the end of the day, you've got to trust that you're investing in something that might not give you instant gratification, but it is a far more fulfilling long-term investment.
So Lizzie, in the first instance, where can people find you? Is that best on Facebook with the Horse Health Hub?
Yeah, so best thing is to go through Facebook. So you can easily find me under Lizzie McCready, which is my full name, or Empowering Equine Education, which is the business's name. Like you mentioned, I run a free Facebook group called the Horse Health Hub. So I do lots of talks very similar to this, Chris, where Nikki was featured only the other week, and I'm interviewing a saddle fitter tomorrow. So I try to make it quite all-rounded when it comes to horse health. But again, I also then put a lot of my educational emergency content in there as well. And if there's anyone who actually just wants to go deeper on emergency response and really fast track their learning, then you can send me a private message or either pop me an email and I can send you all the details for the course. We can have a little chat about if it's the right thing for you to do at this point in time.
And you've got one starting soon, because I'm thinking I might jump on it if there's a
space
big enough
absolutely.
So, you know, that would be interesting. And some of that is, a lot of it's recorded and things like that. You will be doing live parts of it, but again, that's recorded if you can't actually attend, because I'm used to doing online stuff in other areas, and it's so easy to do these days. It's the difficulty is keeping up with it sometimes.
And that's the nice thing. I try to keep the commitment hours low, so it's really only about 2 to 3 hours a week. So the training videos that are pre-recorded are never any longer than 10 minutes, and then the live teaching sessions are only one night a week. And like I said, they are always recorded. And one of the ways I love to teach is actually by running people through emergency case scenarios. So we'll be like, this is Bella, she's a 12-year-old Connemara cross mare, and she presents with this whole list of symptoms. And then I put it back to the group and I say, what do you think? And then you then have to put your problem-solving hat on and work through those clinical signs, and then essentially figure out what you think might be going on, what your next steps would be. And then I take you through the full process, because I think it's important to know, if you find your horse with a nail in their foot, not only do you need to know, don't pull that nail out immediately, but what does the long-term prognosis look like for that animal? If the vet pulls it out on the road, what are you then going to be left to do for the next week? What are the chances? What happens if the horse needs to go into hospital? Just so, again, you can really get that bird's eye view, so that then when you're in the moment of an emergency, you're like, okay, I feel like I know my way around here a little bit. So that's combined with then the live sessions when it's all done within a group. So I run them, I'm going to be running them 3 times this year. And the nice thing about working in a group, and Nikki might be able to vouch for this as well, is that you then get to bounce off other people's firsthand experiences. And someone else might ask a question to me that you might not have thought of, but you're like, that's brilliant. I would love to know the answer to that. So it adds a really beautiful dynamic and support and accountability. Because I don't know about you, but I've done a bunch of online courses where I've never gotten to the end of it because I've just fallen off the bandwagon, because there hasn't been any accountability or support. Whereas here, I do try to guide you through. We have weekly check-ins, and then we're always just only at the touch of a button away of me being able to make sure that you're on track for getting your certificate.
And it's worldwide, isn't it? Because although you're based in Oz, although you're in UK at the moment, aren't you?
Yes.
But this morning, I think you had 85 people on, and there was Australia and America and all sorts. So
yeah, it's getting there.
I love about the online stuff, that you can sit there and see how many other people are actually engaged with the same thing at the same moment as you're doing it. I think it brings a great energy to it.
Yes, it's fantastic. It's really special, and I hope it's something that continues. And hopefully, now that COVID's kind of past us, hopefully people don't just go back to their normal lives and forget what the online space can do, because it's incredible. I wouldn't have met Nikki if I hadn't done the course, and then we wouldn't be having this conversation, Chris. So I think that the ripple effect is huge, and that's one thing I really love about the course, is that you then learning it doesn't stop with just you, and it also doesn't just stop with your horse. It might also be your friend's horse. If you're driving down the motorway and you see someone has been in a floating accident, you might be able to get out and help them. And if you're an equine professional, it's every single horse you're going to come into contact with, because like you said, you just don't know when you might rock up to do a bodywork session and actually the horse has got laminitis, or maybe they've got a touch of colic. And I've been caught out by that a couple of times with my acupuncture. I thought, thank God I'm a vet, because I still know what to do.
Yeah. And I'd just like to say, for anyone who does want to, or was considering doing the course with Lizzie, like, it's just so good the way you structure it and the way you teach it, Lizzie. It's for me, I find learning quite hard to do. Like I've always struggled with learning, but I found it so engaging. It was really easy for me to learn, but also I never felt condescended in any way. Like, you know, I felt supported by you, and I felt like everybody engaged and nobody said anything silly. Like that was so important to me, for my learning experience with you on your course, and I think probably everyone else was probably the same. So yeah, anyone looking to do a course with you, Lizzie, like I 100% recommend it for, you know, for horse owners, for professionals, whoever it is.
Yeah. Amazing. Thanks, Nikki. That's actually, it's really nice that you touched on not feeling condescended, because I had another client who came in and she was a little bit nervous about being in a group. I think she thought it might be a bit cliquey. And I was like, don't worry. I know everyone that comes in through the doors. Everyone is really like-minded. Everyone's really passionate and very supportive of each other. And it was great to see her confidence grow. She's like a little snail coming out of her shell. And by the end of it, she was asking 10 questions in the live sessions. And you could just tell that she felt really supported by the group, which is great, because a lot of the time it's people that have never met each other before, but we're all connected by this really strong common thread of wanting to learn and just wanting to be the best horse people we can be.
Wow, that's fantastic. I think we'll wind it up there, and Lizzie, I just have to say thank you very much. It's very commendable to bring this to the, you know, the equine community at large. I just
thank you so much.
A few years ago, but you would have been too young.
So I'm here now, and I'm also so excited to be stepping more into the equine touch world. I'm really looking forward to it.
Be doing a course with Nikki, aren't you?
Yes, really looking forward to it. It's just
start of Feb.
Yeah,
how much training can we get in you before you leave the UK?
I know.
I'm literally getting as much as I can. Lizzie.
Fingers crossed. Absolutely. But you know what? The further I've sidestepped from being a traditional vet, the more I've realized vets don't know everything. And it's actually really important that, again, we continue that self-development and that we're already looking at the horse from the ground up. So that's one bonus about, yes, you come and do emergency training, but we also have lots of other discussions about other horse health related things as well.
Yeah, definitely. And then also don't forget, we've got this event at the end of the month.
Oh God, yeah.
Yes,
I'm going to be there as well.
I do a little announcement for it, Nick.
Yeah. Oh God, I've forgotten what it's called now.
It's called the Equine Touch
Wellness
Clinic. Yeah, I think so. I think that's what I called it. But
whole horse wellness clinic.
Whole horse wellness. Yeah. But down on the Sussex-Kent border. So we're kind of trying to stretch a little bit out more into the Sussex side at the minute. But just going to be fantastic. We've got Lizzie coming to do a talk. Chris is going to come down and support me, which is amazing. And then we've got Sarah Udo, I think that's how you pronounce his surname. She's doing the saddling talk. Who else we've got? We've got Vicky Wise doing a bit and bridle fitting talk or demo. And oh goodness, who else we've got? We've got Penny. Penny Thorpe, she's coming to do that as well, do a talk and a demo on the podiatry side. She's down Sussex way, so she's going to come and join us, which is amazing. And have we got anyone else? Am I missing somebody? Me?
Yes, you're going to be doing some equine touch as well, Nikki.
Yeah, we're going to do some equine touch demos, and maybe Chris will be doing something on VHT.
I'll be doing some things on humans, certainly. Looking at the imbalances in the human body and how that translates onto the horse. How that, creates difficulty for the horse. So so it's going to be really fun. So hopefully people can come along. It's £45 a ticket. Make sure you buy your ticket ahead, otherwise we won't be able to let you in. We need to know who's coming, and also we need to know in advance so we can make sure we can run the course on the day. But it's going to be great, and hopefully I should be getting a caterer in as well. I'm just trying to work on that at the minute, so we get some hot food and drinks and things there as well. Maybe just get one of those pizza wagons to turn up. Sometimes you
I thought something like that would be quite fun, wouldn't it? Yeah, and then just sorts of tea and coffee, keep us warm, keep us going. But also great thing is we've got this amazing international arena, Bodiam International Arena, and it's got a really nice big indoor mezzanine area where you can see the arena as well. So we'll do some lectures in there, and then we've got the massive, it's huge, beautiful indoor arena, so we can do demos there as well. So people won't get too cold, hopefully, because we'll do a bit of inside out.
We'll have to huddle together.
Yeah, exactly. Yeah, so fingers crossed we can make it all go ahead.
Yeah, fantastic.
Fantastic, Nikki, a brilliant initiative, because I'd already thought about doing stuff up here in the north, but it's still getting things off the ground. It takes a lot of energy, all these things. So you guys are just doing such a fantastic job, especially when you're doing it amongst all your other work as well, So, you know, fantastic. Good on you.
Yeah.
Good on you, girls.
That's amazing. I'm really looking forward to it. Like, how often do you get such a wide spectrum of professionals all in one place?
Yeah.
If I was a horse owner, I'd be going there with my little A4 list of questions.
Yeah.
And I'd be pinning everyone down and getting kind of
Exactly.
a full horse perspective.
Exactly. It's like a pretty good bargain, really, isn't it? For £45, like you get all these professionals in one room and you can talk to them and speak to them and interact. So lots of learning to do. So yeah, I think it's going to be fun.
That's brilliant, Nikki. No, we're really looking forward to it. That's the 27th, isn't it? January?
28th of January.
28th, Saturday.
Yeah, Saturday. Last Saturday in January.
That's it. Fantastic. Well, thanks very much, Nikki, for joining us and your contributions. Thank you very much, Lizzie. Dr. Lizzie, I'll call you. And hopefully everyone's enjoyed our chat. And you had some great comments. And actually, Jenny Zarek, who I know from Yorkshire Way, she said that her vet used to give them a laminated A4 thing with questions to ask, how to do bandaging and things like that. So there are people out there who are trying to support the horse owners.
Good.
So, that's Yorkshire's always a good place to be. Lots of horses.
Wonderful. Well, I'll see you both on the 28th.
28th. Yeah.
Brilliant. On the 28th.
Wonderful.
Cheers,
thanks, everybody.
Bye.
Bye.
Bye. Bye.